So, very good afternoon to all. Last class we have discussed about the epidemiological measurements tools, and we have came into so many new terms like mortality indicators, prevalence, incidence, etc. So, today we will be discussing about the utmost important part of community medicine, that is research. So, as novice researchers, you should build a depth, you should have an in-depth knowledge, or you should build a strong base in epidemiological designs. So for counterpassing the future competition ahead. So today we will be discussing about the study designs, and coming to our medical field, we will be mostly dealing about two classical study design, that will be observational and experimental. Okay, under observational, an investigator will be observing the things. The researcher or investigator will not intervene, or he will just observe what is happening. The classical example is the lung cancer, smoking and lung cancer. Like how smoking causes lung cancers. Like an investigator will be observing 50 smokers, and he'll observe him for another coming 5 years, and will look for who all developed lung cancer. Okay, so that is a classical example of observational study. The main difference from experimental is that he will be just observing. He will not do any intervention part. Okay, so observational can be again classified into descriptive and analytical. Okay, two main classification which comes under observational are descriptive and analytical. Descriptive, here the investigator just describes what is happening. Okay, a classical example will be the Nipah outbreak in Perambra place, where first we will be doing a descriptive study, where the investigator will go to the field. He will just describe the distribution of the disease. Like he will describe in the sense where it happened, at what time it happened, to whom it happened. Okay, that will be a classical example of descriptive study. Under descriptive, there are two subdivisions, that is case series and case report. Case report is the one now I just told, the Nipah outbreak thing. A investigator going to the field, writing about the case, place, time, person. Okay, and if he is collecting few more cases of Nipah and together he is writing a report, that means case series. Okay, so a collection of case reports forms a case series. Next one is analytical. So the second part of observational study is analytical, when we have a comparison group. Okay, so if we do have a comparison group, or if we want to find some association between an exposure and outcome, we go for analytical study, which is again classified under four headings. One is ecological, cross-sectional, case control and cohort. First one is ecological. If you are studying a population of a country as a whole, and you are comparing the population of India with another country like China or Japan, like you want to compare the prevalence of influenza, okay, H1N1 in Indian population with another country like China or Japan population, then we go for an ecological study design. And next comes the cross-sectional study design. Cross-sectional study design, actually you should be having a clear picture, because it can come under descriptive also. If you are just doing a prevalence study, if you want to know the prevalence of diabetes in Modakallur district, so here just we are going for what percentage of population, or what is the prevalence of diabetes in Modakallur population. So here we do a descriptive cross-sectional study, because we don't have a comparison group. We are just looking for the percentage or the population having diabetes in Modakallur area. Okay, so if you are looking just for the prevalence of a particular disease in a population, that comes under descriptive cross-sectional study. So cross-sectional study can also come under analytical part when there is a comparison group. An example is that if you are comparing the obesity of CBME 1 students with CBME phase 2 students. Okay, here two groups are there, but what we are comparing is obesity. Like it's just the prevalence we are comparing among two batches, but here one comparison group is there, so we will doing an analytical cross-sectional study. So next comes cohort is there. If cohort is also known as forward looking study or prospective study. Okay, in cohort we will take the classical example, smoking and lung cancer. Okay, we will be looking like it comes under observational study, so we will be just observing only. So we will take 50 smokers and 50 non-smokers. We observe them for another 5 years. Now it is 2024, right? We will observe them till 2029 and we will look for who all develop lung cancer. Okay, so out of 50 smokers, how many develop lung cancer? Out of 50 non-smokers, how many develop lung cancer? So here we are looking forward, we are going forward. It's known as cohort or a prospective study. And last one is here, case control. The name itself, from the name itself we can understand the study begins from the cases. Case control. Case means the study begins from the case. The case example is that the same example of lung cancer and smoking. Here we start with the lung cancer patients. Okay, cases are lung cancer patient. We'll ask them the history of smoking, like did you smoke or do you have a history of smoking or not. So we are going backward from cases. So that is a case control study. Same way we will be taking as the control, we will be taking those who are having no lung cancer, and we will ask whether they smoked or not. So that is what happens in a case control study. So the second part, so our observational part is over. Now we comes to the experimental part. When the investigator or a researcher do some intervention, it comes under experimental study design, which is again divided into two, RCT and non-RCT. RCT means in experimental study, like the investigator is doing something. Okay, he is not observing, here he intervenes. He do some interventions or he do some experiment, and if he select his study participants randomly, it comes under random control trial. And if he is not taking them randomly according to his convenience, then it comes under non-RCT, non-randomized control trial. Okay, so these are the two main study design, observational and experimental. And observation is again classified into two, descriptive and analytic, and experimental into RCT and non-RCT. So as I mentioned, if the investigator assign an exposure, okay, if it is yes, then it comes under experimental study. If it is, the answer is no, then observational study. And in observational study, if there is a comparison group, it is known as analytical study. If no comparison group, it is known as descriptive study. And according to the direction, if we are looking forward, we are going forward, then it's a cohort study, or we are going backward, then it's a case control study, or at that particular moment, if we are taking the data, it is a cross-sectional study. Okay. And coming to the experimental study, if the study participants are selected randomly, it is an randomized control trial, or no randomization is done, we are taking the study participants conveniently, then it comes under non-randomized control trial. And types of research, like this is the broader classification of type of researchers, a type of research that can happen in the medical field. Based on purpose, we can again divide into qualitative and quantitative. The quantitative part is what I explained already, the experimental, observational part, etc. Another type of research is there, which is an upcoming thing, qualitative research, which can again be classified under the headings phenomenology, ethnography, grounded theory, case study, historical, etc. Okay, phenomenology means like if we are going in depth of a person's experience and all, we go for a phenomenology, qualitative research. Ethnography means if you are going for if you are studying some cultural beliefs or social customs and all, we go for ethnography, qualitative research. And last, if our purpose is for creating or making a theory, we go for a grounded theory, qualitative research. Okay. And the study designs coming under the hierarchy of evidence, we can classify we can categorize the study design, like which is the most powerful thing. So it starts from case report. It starts from case report, opinion papers, letters, and the power start increasing to the most powerful is meta-analysis and systematic review. Here one thing is like this meta-analysis and systemic reviews are for secondary data. Okay, something have been already researched or done, we are collecting that data and we are doing analysis. Okay, that comes under meta-analysis and systematic review, and that is the strongest. But if you are considering a primary data, like we itself are collecting something and we itself are doing the research, the most powerful will be RCT. Okay, randomized control trial. So we will go more in detail. First one is descriptive epidemiology. Usually the first phase of an epidemiological investigation, usually concerned with observation or distribution of a disease, like how it is distributed. Okay, it identifies the characteristics with which the disease in question seems to be associated. So it mainly deals with these three questions: when is the disease occurring, what time, where it is occurring, and who is getting the disease. So this spot map you may all be knowing. This is John Snow's spot map of cholera. This was the first spot map developed, and it's of the Golden Square district in London. Okay, he spot mapped for cholera, and he found out the water is the main cause for causing cholera outbreak there. Okay, so it's in the Broad Street of Golden Square where he has spot map, and he came into the conclusion like that a pipe connection there is spreading this disease. Okay, so steps in a descriptive epidemiology is, first you have to define the population to be studied. Which population are you going to study? Second step is defining the disease under study. Like as I told, I was doing a prevalence study to know the prevalence of diabetes in Modakalur disease. Here the population will be Modakalur population, and the defining the disease under study will be diabetes, and describing the disease like time, place, person, and measurement of disease. Here the measurement will be in percentage, like how many percentage of people in Modakalur are having diabetes, comparing with known indices, and formulation of an etiological hypothesis, like whether it is more than the usual data or lesser than the usual data. So the two types are here. I have already mentioned case report and case series. Case report are careful, detailed report by one or more clinicians of the profile of a single patient. Okay, just take case of a single patient, like the students taking a case in the ward, all comes under case report. Case series describes characteristics of a number of patients with a given disease. We are combining the case reports and writing a report, that comes under case series. So routine surveillance program often use accumulating case reports to suggest the emergence of new disease or epidemics. Advantages are can aggregate the cases from disparate sources to generate hypothesis, describe a new syndrome, like that. So these are some of the advantages of descriptive study or case report. And limitation is we cannot go for any association or statistical things. Okay, here just we are taking a case, we are writing a report. Okay, so we cannot go for a statistical association. And the another descriptive study, as I mentioned, was cross-sectional study. It's the simplest form of observational study. It's mainly done to know the prevalence of a population. So first we have to define the population, define the disease. The same example, Modakalur diabetes. We have to define the population, define the disease. Here is we are going for the prevalence of diabetes. Single examination of a cross-section of the population. Like a single day I can do that. Okay, results are projected on whole population. So these are the main difference between descriptive and analytical epidemiology. What, who, where and when. Analytical will be dealing with how and why. Okay. See, describe the occurrence of outcome or exposure. Analyze the association between exposure and outcome. So analytical, we go for, if you want to find an association, we go for an analytical study. Here no control group, a comparison group will be there in the analytical study. And here descriptive epidemiology is used to formulate a hypothesis, and analytical epidemiology usually we go for testing the hypothesis. So core steps in an analytical study is we determine whether there is an association between a factor and the development of a disease, and we derive appropriate inference regarding a possible causal relationship, the pattern of association that have been found. So analytical cross-sectional study is done to find out mainly the association between a disease and an exposure. Exposure and disease are assessed at the same point of time. Cannot always distinguish whether which exposure preceded the development of disease. Okay, temporal association, like all the time we cannot come into a conclusion of temporal association. Okay. Advantage for a cross-sectional study is that it is no waiting period, outcome, or there will not be a waiting period, like you don't have to follow them for another 5 years or 2 years. You will get at that point itself. Okay, fast and inexpensive, no loss to follow, prevalence of the disease can be calculated, risk factors can be identified, helps to generate hypothesis and magnitude of the disease. Okay. So disadvantages, difficulty of establishing a causal relationship. You can't say this is the cause of that disease. You cannot get a causal relationship. Okay. Natural history of the disease cannot be studied. Not useful for investigation of a rare disease, and incidence cannot be calculated. So next is like types of analytical, two main types of analytical study, case control and cohort. That will be dealt in the coming classes. So by descriptive part we will be ending today. So any doubts are there, you can ask. Thank you.